Imagine, for just a second, that you are looking at the inside of your own mouth in a mirror. What you should be seeing is this healthy, vibrant pink tissue.
Right, because in medicine, the oral cavity is often called the mirror of the body's health.
Yeah, exactly, because it's incredibly vascular, highly responsive, and just constantly regenerating. But, what happens when that mirror stops reflecting health? Like, what happens when that soft pink tissue turns into this pale, white, leathery landscape that actually restricts you from even opening your mouth?
It becomes a profound structural failure. I mean, the tissue physically turns into a cage.
Wow.
Yeah, the pale pallor isn't just some superficial cosmetic shift. It represents a fundamental microscopic breakdown in the plumbing. The tiny blood vessels that keep that tissue alive and pliable.
And that actually brings us to the core mission of today's deep dive. We are asking a really specific high-stakes question today, which is, can chronic mucosal pale discoloration, which is medically known as pallor, actually return to a healthy pink vascularization with targeted treatment?
It's a big question.
It is. Okay, let's unpack this. We have a great stack of sources today, including clinical trials on a restricted mouth condition called oral submucous fibrosis, some really wild studies on gene therapy in mice, insights from aplastic anemia, and even advanced imaging of gut healing.
Yeah, and to really get into this, we have to start by understanding why the blood abandoned the tissue in the first place. Because the oral mucosa is a frontline tissue. It is constantly bombarded by stressors, thermal changes, spicy foods, chemical irritants.
Right, so when it fails to cope, we see that dramatic loss of pink.
Exactly. But we have to divide this into two completely different categories of failure. So we've got systemic pallor and localized pallor.
Systemic pallor feels a bit more intuitive, I think. Like
Yeah.
in a condition like aplastic anemia, the oral mucosa looks washed out or pale, but the local blood vessels in the mouth are actually perfectly fine.
Right, the failure is happening miles away in the bone marrow.
The plumbing is intact, but the water reservoir is empty.
That's a perfect way to put it. There are simply fewer red blood cells and less hemoglobin circulating through the entire body. And we actually see this frequently as a monitoring tool. For instance, 6 to 9% of post-transplant leukemia patients experience mucosal pallor.
So in those systemic cases, the pale mouth is essentially an alarm bell for your overall health.
Basically, yeah. You treat the underlying bone marrow disease, the global red blood cell count goes up, and the pink color naturally returns to the mouth.
But localized pallor is where things get really intense. And the prime example here is oral submucous fibrosis, or OSF.
Yeah, OSF is highly prevalent in parts of the world where people chew areca nut or betel quid. In OSF, the tissue undergoes this massive physical transformation.
Which causes that blanching phenomenon, right?
Mhm.
Our sources say that shows up in 65 to 93% of these patients, where the mucosa takes on this persistent white, almost marble-like appearance.
Marble-like is a good word for it. It becomes leathery, inelastic, and sometimes it's so severe that patients can barely open their mouths enough to eat solid food.
Which is just terrifying to think about. The best way I can picture this localized pallor is to think of a dried-out riverbed. Like, in systemic pallor, the river is just temporarily low on water. But in OSF, the ground itself is hardened into these thick, fibrous bands of collagen, making it nearly impossible for the water to ever flow back in.
What's fascinating here is the vicious cycle that drives this hardening. It's really a masterclass in pathological loops.
How so?
Well, the chronic chemical irritation from chewing the areca nut causes an overproduction of collagen. This thick collagen matrix physically squeezes and chokes off the local blood vessels.
So they just get crushed.
Right. And when the capillaries are choked, the tissue experiences ischemia, which is a severe drop in blood flow, and hypoxia, which is a lack of oxygen.
You'd assume the body would respond to a lack of oxygen by, desperately trying to fix or widen those blood vessels.
In a healthy system, yes. But in this specific diseased state, the hypoxia acts as this perverse trigger. The lack of oxygen essentially causes the local cells, the fibroblasts, to panic.
Oh, I see.
Yeah, instead of signaling for new blood vessels, that panic makes them dump out continuous streams of pro-inflammatory cytokines. These chemical messengers basically tell the fibroblasts to lay down even more collagen type 1.
Wait, so the new collagen chokes the remaining vessels even tighter?
Exactly. Which causes more hypoxia, which triggers more collagen. It feeds on itself until the tissue is left completely avascular, white, and marble-like.
Okay, so if the tissue has turned into this concrete-like riverbed, how do doctors mechanically and chemically force the rivers back open? Looking at the clinical arsenal, it seems the standard baseline attack uses a combination of dexamethasone and hyaluronidase.
Yeah, this is a localized injection strategy aimed directly at breaking that cycle we just talked about.
Mm.
Dexamethasone is a highly potent corticosteroid.
Right, to stop inflammation.
Right. Its biological job is to enter the tissue and shut down the immune cells that are secreting those panic-inducing inflammatory cytokines. It basically pulls the fire alarm, stopping the signaling for more fibrosis.
And then the hyaluronidase acts like a chemical machete.
A chemical machete, yes. It's an enzyme that specifically targets and cleaves the glucosaminidic bonds in hyaluronic acid. And hyaluronic acid is a major structural component holding all that connective tissue together.
So when it's injected, it literally chemically degrades the glue of those tough fibrous bands.
Exactly. It softens the concrete, trying to make physical room for the compressed blood vessels to pop back open.
Doctors also add vasodilators to the mix, right? Specifically a drug called pentoxifylline. The goal there is to actively force the existing narrowed blood vessels to open up and increase mucosal vascularity.
Yeah, to get the flow going again.
But the treatment that really caught my eye in the sources is Placentrex, which is, and I had to double check this, an aqueous extract of human placenta injected directly into the lesions.
It sounds wild, but biologically it makes a lot of sense. The placenta is inherently designed by nature to support rapid growth and angiogenesis, which is the formation of new blood vessels.
Okay, that tracks.
Yeah, so this biomaterial extract is packed with nucleotides, enzymes, and essential vitamins that operate on a cellular level. It contains vitamin A, or retinol, which regulates epithelial cell differentiation. In this context, it steps in to stop the damaged cells from turning rogue and potentially malignant.
And it also contains vitamin E, which specifically helps improve the mucosal color and reduce those fibrous bands.
Because vitamin E is a powerful antioxidant. Going back to that hypoxic panic, one of the byproducts of oxygen-starved tissue is a massive release of reactive oxygen species, these free radicals that damage cells and trigger more scarring.
So the vitamin E comes in and cleans that up.
Right. It scavenges and neutralizes those free radicals, essentially throwing water on the biochemical fire that's driving the fibrosis.
Plus, the Placentrex has a physical mechanism, doesn't it? As this placental extract sits in the tissue and is slowly absorbed over time, the fluid volume actually acts as a mechanical spacer.
Exactly.
It physically holds the tissue layers apart to prevent the collagen fibers from cross-linking and fusing back together into those tight bands.
It's a dual threat. It tackles the disease through both a biochemical and a biomechanical pathway.
But let me push back on this for a second. With all these injections, like the steroids, the enzymes, the vasodilators, are we just temporarily turning on a high-pressure hose to force blood into a broken pipe?
That's a fair question.
Like, if the endothelial cells, the specialized cells that line the inside of the blood vessels, if they are severely damaged, won't the blood just stop flowing the minute the drugs wear off?
That is the central hurdle of treating mucosal pallor, absolutely. It has to be a dual approach. You absolutely must dissolve the physical barrier. So the chemical machete of hyaluronidase and the mechanical spacing of Placentrex accomplish that.
Because if you don't break the concrete, no water can flow.
Right. But you also have to heal the endothelial dysfunction. Vasodilators like pentoxifylline don't just briefly widen the pipe. They actually alter the rheology of the blood itself.
The rheology sech, like the way it flows.
Yes. They make the red blood cells themselves more flexible or squishy and reduce the overall viscosity of the blood. This allows the red blood cells to squeeze through those narrow, damaged pipes and finally deliver oxygen to the hypoxic tissue.
Oh, wow. And once that oxygen returns, the panic loop is broken. The tissue just stops screaming for more collagen.
Exactly. But, the chemical cocktails are powerful, but sometimes they simply aren't enough for severely damaged tissue where the microcirculation has been completely obliterated.
Which brings us to the heavier artillery. When the chemical hose fails, medicine turns to structural remodeling, and one of the most intense examples of vascular destruction comes from radiation therapy.
Yeah, radiation is brutal on the microvasculature.
Right. We're looking at patients with late irradiation injury in their head and neck. The radiation just completely shreds the microplumbing. And to fix this, doctors use HBOT, hyperbaric oxygen therapy.
Right. So in HBOT, the patient enters a specialized chamber where they breathe 100% pure oxygen under increased atmospheric pressure.
Which bypasses the blood cells entirely, right?
Yes. It completely bypasses the need for red blood cells to carry the oxygen. The pressure physically forces a massive amount of oxygen to dissolve directly into the blood plasma itself. The plasma then diffuses this pure oxygen deep into the scarred avascular tissue.
The results in irradiated oral tissue are just wild. By using a handheld microscope to look directly at the oral microcirculation, researchers tracked patients who went through this pressurized oxygen protocol.
And what did they find?
By 6 months post-treatment, the patient showed a highly significant increase in mean buccal vessel density. The blood vessels literally sprouted and grew back into the pale tissue.
But the secondary finding in that study is arguably even more vital. The HBOT didn't just increase the number of vessels, it actually decreased the vessel diameter.
Wait, really? If we want more blood flow to bring the pink back, wouldn't we want wider vessels? Why is a decreased diameter a good thing?
It seems counterintuitive, I know. But we have to look at what radiation actually does to endothelial cells. It causes profound DNA damage, leading to broken, ballooning, abnormal vessels known as telangiectatic tissues.
Oh, I've heard of those.
Yeah, they are leaky, engorged, chaotic pools of blood. They're physically wide, but the blood inside them is totally stagnant. They aren't efficiently delivering oxygen at all. They're basically just broken pipes flooding the basement.
So they're swollen and totally non-functional.
Right. The hyperbaric oxygen therapy creates such a steep oxygen gradient in the tissue that it forces the microcirculation parameters back toward the size and shape of healthy tissue.
It's forcing order out of chaos.
Yes, it signals the macrophages to clean up the cellular debris, and it prompts the chaotic vessel loops to reorganize back into narrow, tight, highly efficient capillaries.
And when you pair that intense oxygen environment with cellular architects like mesenchymal stem cells,
Yeah.
the results compound, right? The high oxygen plasma provides the raw metabolic fuel, which dramatically boosts the stem cell's ability to multiply, migrate to the damaged site, and lay down fresh, healthy structural proteins instead of pathological collagen.
The oxygen is the building material, and the stem cells are the highly skilled construction crew rebuilding the tissue architecture.
So what does this all mean? It means we aren't just patching things up. We can actually force the body to structurally rebuild its microplumbing from the ground up, even after catastrophic damage like radiation.
Provided, of course, the local cells still retain the right genetic instructions to know how to build a blood vessel.
Right. But what if the body has essentially forgotten that blueprint? In chronic late-stage fibrotic diseases like severe OSF, the tissue is so far gone that just providing oxygen and stem cells isn't enough.
No, it's not.
We have to transition from supplying oxygen to supplying the actual genetic code for building blood vessels.
We are crossing into the absolute frontier of gene therapy here. The master architect of building blood vessels is a protein called VEGF, vascular endothelial growth factor.
VEGF.
Right. VEGF is the body's primary signal that tells endothelial cells to proliferate, migrate, and form complex new vascular networks. In the advanced pale stages of fibrotic diseases, the expression of VEGF drops off a cliff. The signal just goes completely silent.
So researchers decided to artificially put that signal back. There's a groundbreaking study on mice with induced oral submucous fibrosis. The tissue in these mice had advanced to that pale, hardened, avascular state.
And this is where it gets crazy.
It is crazy. The researchers used a viral vector, specifically an adenovirus. For anyone listening who is unfamiliar, an adenovirus in this context is basically a microscopic delivery truck. They hollowed out all the harmful, disease-causing parts of the virus and packed the empty shell with the human gene for VEGF. 165.
The ADEGFP, VEGF165 vector. They injected this hollowed-out payload-carrying virus directly into the fibrotic tissue of the mice, and the virus did what viruses do best. It docked onto the local fibroblasts and injected its genetic material directly into the cell's nuclei.
But instead of hijacking the cell to make more viruses and make the mouse sick, it inserted the genetic blueprint for VEGF.
It hijacked the diseased cells and turned them into microscopic factories, tricking them into constantly pumping out the master angiogenic stimulator.
And the proof of this hijacking is undeniable. Using CD34 staining, which is a technique that specifically highlights and dyes vascular endothelial cells, researchers looked at the tissue under a microscope.
The results were massive.
Unbelievable, really. The tissues that received the VEGF gene therapy showed a massive, statistically significant explosion of new blood vessels in the lamina propria, which is the connective tissue just under the surface layer.
The genetic transfection literally restored angiogenesis in the pale, fibrotic mouse mouths. They successfully rebuilt the plumbing by completely rewriting the biological software of the local cells.
It's a phenomenal proof of concept. By targeting the exact molecular deficit, that silent VEGF signal, they reversed the severe hypovascularity that drives the disease state.
Right, but if we connect this to the bigger picture,
Well, here's where it gets really interesting, actually. We've talked a lot about getting the blood back, about increasing vessel density and fighting pallor. But, if I'm looking in the mirror at my mouth and it goes from pale, leathery white to bright red, how do we know the tissue is actually returning to a healthy pink and not just becoming an inflamed, angry, leaking red?
That's a great distinction.
Because more blood doesn't automatically mean healthy tissue. Inflammation brings a rush of blood, too.
Exactly. You are hitting on the exact definition of true vascular healing. To truly understand what this healed state looks like, gastroenterologists actually have a perfect model for this when they look at the gut, specifically in tracking the healing of ulcerative colitis.
The imaging technology they use for this is absolutely mind-blowing.
It really is. In assessing ulcerative colitis, they use ultra-high magnifying narrowband imaging, or NBI. This optical technology can zoom in on living tissue up to 500 times magnification.
500 times.
Yeah, it allows doctors to look directly at the living microvascular patterns in real time. By looking at the gut at 500x, they have clearly defined the microscopic difference between true vascular healing and tissue that is just vascular active, meaning inflamed and swollen.
So paint that picture for us. What does true, healthy pink healing actually look like at 500 times magnification?
Okay, so true remitted healthy mucosa features a highly regular honeycomb-like capillary network. The vessels are uniformly thin, they are evenly distributed across the tissue, and there is zero congestion or fluid leakage. It looks like a perfectly organized microscopic geometric grid.
A flawlessly engineered plumbing system.
Contrast that perfectly ordered honeycomb with vascular active or inflamed tissue. Even if the tissue is only mildly inflamed, the 500x imaging reveals a chaotic, dilated, and tortuous vascular pattern.
So it's all messy and tangled.
Completely messy. The vessel density is highly heterogeneous, so it's clumped in heavy masses in some areas, completely missing in others. There is focal blurring everywhere because fluid is leaking out of the damaged vessel walls, and there is a total loss of that normal honeycomb architecture.
So when we are trying to cure mucosal pallor, whether we are dissolving concrete with Placentrex, pushing oxygen into plasma with hyperbaric chambers, or literally rewriting DNA with VEGF gene therapy, the ultimate finish line isn't just making the mouth red again.
No, definitely not.
It's not about flushing the leathery tissue with a chaotic swamp of leaky, swollen vessels. True reversal of pallor is about successfully rebuilding that perfect microscopic honeycomb.
It is entirely about restoring functional structural order to the microenvironment. That exact geometric organization of capillaries is what gives healthy mucosa its firm, resilient, vibrant pink quality, as opposed to an angry, swollen red or a dead avascular white.
And that brings us perfectly back to our core mission for this deep dive. We asked, can chronic mucosal pale discoloration return to a healthy pink vascularization with targeted treatment? Looking across this vast landscape of medical mechanics, the answer is a resounding yes.
The clinical and microscopic evidence proves it is possible. It is incredibly difficult, and the interventions require attacking the problem chemically, mechanically, and sometimes genetically. But the biological pathway for reversal absolutely exists.
Whether the fix requires mechanically cleaving fibrous bonds with enzymes, flooding starved tissue with pressurized oxygen to shrink ballooning capillaries, or literally hijacking fibroblasts to sprout a brand new honeycomb of vessels.
Yeah.
The body's pale, leathery state is not a permanent death sentence.
The most vital takeaway for you listening is recognizing the sheer astonishing resilience of human tissue. What looks irreparably dead or permanently scarred is very often just a biological system trapped in a negative feedback loop.
It's just stuck.
Yeah, it has hit pause, waiting for the right mechanical, chemical, or genetic key to unlock its inherent natural drive to regenerate.
It's just waiting for the right blueprint to start rebuilding. And that leaves me with one final provocative thought for you to mull over. We just talked about that incredible 500-power zoom endoscopy used to map the vascular honeycomb in ulcerative colitis.
Right?
Well, the authors of that study are currently integrating artificial intelligence to predict vascular healing based on recognizing those microscopic patterns faster than a human ever could.
AI pattern recognition sweeping the microplumbing.
Exactly. Imagine a future, which might be much closer than we think, where you sit down at your regular dentist for a routine cleaning. They sweep a simple AI-assisted optical wand around the inside of your mouth. And before you ever notice a change in your bathroom mirror, Long before the tissue ever loses that healthy pink hue and becomes stiff, the AI predicts the microscopic vascular drop-offs happening beneath the surface.
It catches the cellular panic and the river drying up before the ground ever hardens.
Exactly. We could be looking at a world where we diagnose and treat mucosal pallor long before it ever has the chance to steal the color from the mirror of your health.